Hello, welcome back. I am your uncle, Andy. Today I am looking at a topic that concerns everyone in our communities and societies. I'm talking on the topic, giving first aid to an injured person. Rendering first aid to an injured person is a sure way of saving many lives from untimely death. We are in a season of shaking, shootings, maimings, killings, and all sorts of shakings. This is the time for alertness and willingness of bystanders to assist fellow human and avert premature death. All around our communities are injured people from accidents, from fire outbreak, from gunshots, machete cut, fall from height, drowning, inhalation and ingestion of poisonous substances, electric shock, bites from insects, animals, stings, sudden illnesses, and so on and so forth. This and lots more are the major causes of premature death. Typically, it is the bystander who recognizes a situation as an emergency and decides to intervene to help the victim by taking quick and reliable action to save the life. Many laypersons are less likely to offer help due to their ignorance, confusion about what first aid and emergency is all about, fear of the pressure from other bystanders, or it could be as a result of unpleasant attitude of the victim for those that are conscious to resist help. Let's answer this question. What is first aid? First aid is the immediate care given to an injured or suddenly ill person before the arrival of proper medical treatment. First aid consists only of giving temporary assistance until competent medical care, if needed, is obtained or until the chance of recovery. First aid does not take the place of proper medical treatment. Properly applied first aid may mean the difference between life and death. Properly applied first aid may mean the difference between rapid recovery and long hospitalization, or temporary disability and permanent injury. First aid involves more than what people do for others. It also involves things you can do for yourself, things you can do for your children, your spouse, your brethren, your neighbors, and all those that come your way. We are our brother's keeper, and we should keep ourselves in the position of first aiders. However, due to legal and ethical issues concerned, all first aiders are required to obtain consent from the victim, where the victim is, number one, conscious and not a child. This leads me to consent giving. First aid treatment or management without victims' consent is unlawful. And we are living in the days of litigation. The on-the-spot consent given by the victim for first aid management could be a yes answer when asked if the first aid should be rendered or given to the victim. Or the victim could give the yes answer by nodding his or her head. In other words, the first aider should, as a matter of fact, number one, introduce himself or herself to the victim before making an attempt to render first aid. Number two, the first aider should explain what he or she wants to do in order to help the victim in that situation. Number three, the first aider should take permission from the victim, which could be expressed verbally or a nod of head. Otherwise, unconscious victims and those with life-threatening conditions and unresponsive victims are assumed to consent to life-saving interventions. Seldomly, a person may refuse assistance for countless reasons. Such reasons may include, number one, religious grounds. Number two, avoidance of possible pain. And number three, desire to be examined by a qualified medical doctor. Whatever reason for the refusal of care, it is striking and it is important I mention here that a mentally competent adult cannot reject help. This leads me to bleeding control, majorly external bleeding control. For a start, I am considering external bleeding control. Bleeding in the medical terms is called hemorrhage. Bleeding leads to blood loss or loss of blood. Bleeding results from wound, which could be incised, lacerated, contused, or punctured. These are medical terms that many lay people may not really understand. These are the types of wounds. Bleeding can give rise to shock. What is shock? Shock is a condition of sudden depression of the nervous system resulting from and occurring after every case, accident, or sudden illness. Shock is increased by loss of blood, severe pain, mental anxiety, and exposure to cold. What are the objectives of first aid treatment? The objectives of first aid treatment of wounds are, number one, to stop the bleeding. Number two, to lessen the effects of shock. And number three, to prevent germs, what is otherwise called microorganisms, from contaminating the wound. Let's get into bleeding control proper. Number one, we should live with this consciousness that we can come across a bleeding victim at any time. It could be along the road, through accident. Somebody may sustain injury and begin to bleed. So it is advisable to always carry with you your face mask and sterile glove, at least a pair, in your bag or pocket. As you come across a bleeding victim, number one, reassure the victim. Introduce yourself to the victim and tell him that, or him or her, that you want to render help by applying first aid. Where consent has been given, place the victim or the patient in a suitable position. Locate the bleeding source, the point of bleeding. Elevate the bleeding part, except in case of fractured limb. Place sterile or your cleanest handkerchief, white handkerchief, laundered, or cleanest cloth available over the wound, and immediately apply pressure with the thumb or fingers. Make sure you loose the victim's tight constrictions around the neck, the waist, and even the wrist. Do not remove the blood-soaked dressing or cloth so as not to dislodge the blood that has formed mesh, what we call blood clot, to seal up the bleeding vessel. If the bleeding stops, seek medical attention if needed for expert management. Finally, on this note, in case it was an accident victim, endeavor to report the case to the police for substantial evidence. Let's look at bleeding from special organs. Under bleeding from special organs, I'll look at two organs. Number one, bleeding from the nose, and number two, bleeding from the ear channel. Let's get to number one. Number one special organ, bleeding from the nose. What should we do, or what kind of first aid can we render in this case? Number one, reassure the victim, because they are always afraid that they will die as a result of the nose bleeding. They are usually frightened. Number two, place the patient or the victim in a sitting position in a current of air before an open window or an open space, with the head of the victim thrown slightly back and the hands raised above the head. Number three, loosen all tight clothing around the neck, the waist, and the chest area. Number four, cause the victim or the patient to keep the mouth open and so avoid breathing through the nose. Number five, apply cold compress over the nose and also the spine at the level of the collar. Place the feet of the victim in warm water. That is to say, if you can come by ice block, you can use handkerchief to wrap around the ice block and place on the nose of the victim. Number six, warn the victim not to blow the nose, and quickly make an arrangement to transport the victim to the hospital or any nearby health facility. Let's look at number two, bleeding from the ear channel. What you as a first aider should do when coming across a victim or patient bleeding from the ear channel. Number one, understand that the victim is frightened. Reassure the victim. Number two, make no attempt to block or plug the ear. If you do, let it be with a dry dressing, and then you bandage it. Immediately, arrange for a vehicle to convey the victim to any nearby hospital or health facility. With these measures, I believe you'll be able to save a life, and you'll be able to be your brother's keeper. If this is your first time here, like the video and subscribe. You will be among the first to receive the upcoming videos. Thank you.